Today's guest is Dr. Chris Motley, a practitioner who blends ancient healing wisdom with modern science in a way that's not only fascinating but deeply human. Dr. Motley's approach is heart-centered, holistic, and deeply attuned to the body's own intelligence, and we spent a lot of time talking about that. He weaves together Eastern medicine, chiropractic, functional lab testing, and emotional energetics into a healing philosophy that respects both tradition and innovation. This conversation isn't just about protocols or test results. It's about listening to the body, trusting the process, empowering our health consumer clients, and healing from the inside out. So whether you're a science-minded coach or someone who leans into energy and intuition, you'll find something to love in this episode. Let's dive in. Hi, I'm Erin Power. I'm a health coach, a health coaching educator and mentor, and your host of Health Coach Radio. This podcast delves into the art, science, and business of health coaching. Whether you're aspiring to land a coaching dream job or to embark on your own entrepreneurial adventure, we cover it all. Our mission is to help you grow your career, elevate your income, change the lives of the clients who need your help, and leave a lasting mark in this rapidly growing field. It's time for health coaches to make an impact. It's time for Health Coach Radio. All right, Dr. Motley, I've been looking so forward to this because you have such a unique way of weaving ancestral health healing traditions with cutting-edge science, and I cannot wait to explore that intersection with you today. Aww. So to kick things off, can you give us a glimpse into your background and how you combine traditional Chinese medicine, kinesiology, and frequency medicine into one powerful practice?
Oh, thank you for the intro. I really appreciate that. When I first got into Chinese medicine, I did it because it worked on me. And I remember that I had a really bad rear end accident right before I went to chiropractic university, and my neck would not be stable. Fast forward, I kept getting different adjustments, muscle work, and it worked a bit, but I kept having my neck slip back out of place. And one of the things I noticed was one of my friends, Steve, who was another practitioner, he's a clinician, he says, hey, he kept checking my neck, and he says, man, I need you to come over and let me check you out. And he did, and he said that it was my gallbladder. Oh. And I didn't really understand at the time what he meant by gallbladder because I wasn't diving deep into Chinese medicine. And the gallbladder meridian, basically in Chinese medicine, runs down your neck. So he worked on that, and my neck didn't go out of place after that. So when I saw that just small, minute effect, I started to really dive into all the acupuncture points in the body. And I started learning a system that integrated the acupuncture system, the meridians, the qi, and biofeedback devices that allow me to monitor the actual qi flow in the body. Ooh. And so I really got intrigued with it because each tissue of the body, organs, all have a specific frequency. And when I started to learn that portion of it and realize that there are ways to monitor the frequency that comes off a tissue, or off of an organ, I really dove deep into those techniques. And my whole practice was based on frequency medicine and application. So then when I started to really understand about color therapy and sound therapy, all those frequency-based modalities really started to hit home with me. I can go through many stories, but I basically came to Tennessee and Nashville. And my dad asked me, he goes, how do you think they're going to take this kind of work where you're at? And I came to Franklin, Tennessee, which is a little suburb of Nashville. And sure enough, I just started off with one person, and then it grew and grew and grew. Not to pat myself on the back. What I am saying is people were seeking a modality because other ways at times didn't function well. That's my deep dive into it.
Amazing. I love an origin story. What I like about that is kind of like a sense of knowing that this is needed in the world of healthcare. Now, when you opened up your clinic, your practice in Tennessee, and that first person came in, and you're thinking, how's this going to go? I'm just curious, like that person, that was your sort of your person, the first person that really bought into this. What was their frustration? What was their frustration or their
condition or problem?
Struggle, their condition, yeah. What brought them to you?
The first patient I remember was a colleague of mine who I did an internship at his clinic. It was his cousin, and she had come in with severe kidney infections. And so at the time, the first issue, I had two that I remember. She came in with a kidney issue with severe fatigue. And the same day, another patient of mine, who's still a friend of mine, she came in and she had severe issues with her ankles. And that was a gallbladder issue. But with my friend, the first patient who had the kidney issues, one of the things you go into practice and you don't get scared. You can't get scared, but you are nervous the first few days that you come into this practice, and you're taught in chiropractic university to do the adjustments, look at all the spinal relays. But this was, in a sense, a little different. I have a person coming in for a kidney problem. Now, the thing was, her signs and symptoms correlated. She definitely had bags underneath her eyes, or dark circles underneath her eyes, which is a sign of kidney and bladder issues. She told me her hair was going white down the center. It's another one. And she had severe calf pain. Now, that calves and the gastrocs and heel pain are associated with the bladder and the kidney. Now, at the time, Aaron, I didn't know all that. I knew a few of them. I knew about the eyes. And when she told me about the calves and heels, I remember I was like, heavens, how am I going to fix somebody's, kidney issue? And my mentor said, just follow the system. And so I just started taking all the trigger points, all the acupuncture points, all the herbs I could, and I threw it at the kidney. Thankfully, being at a young age, I started to see that there was such a huge correlation of organ issues with physical problems. And that set up my practice in the sense that people said, okay, Dr. Motley likes to look at organs and how it relates to their physical structure, and then it got into the emotions. So I'm not saying I had all the answers, but what I would say is many people came to me because if they had a physical problem, other docs would send them over and say, well, if there's some kind of hidden metabolic issue, go to Motley. And those are my first recollections. I never really had the joy, Aaron, of just doing structural. I love structure. I love bones and ligaments, but it started off, it was full on go with organs.
Oh my goodness. It's so fascinating. And can I just share an anecdote that's kind of pertinent to that?
Yeah.
So when you're talking about this patient that has chronic kidney infections, well, I do too. I have that as well. And when you said that there's a connection between gastroc, heel, Achilles, calf, it was interesting because I have had chronic Achilles tendonitis. But the thing is, too, I'd love to know your thoughts on this. This is just completely non sequitur. The antibiotic they put me on for kidney infections is Cipro, which is correlated to Achilles tendon ruptures. Is there something there? Is that am I crazy, or is that all related somehow?
It's all related, Aaron, I don't want any of the audience to think that I'm being cocky. I'm not saying that at all. What I am saying is that with the gastrocs, if you had Cipro and they're going after cleaning up, they use Cipro for like a UTI or kidney infection, the imbalance within the bladder area and the kidneys disrupt the chi that goes from the middle of your foot up the inside of the leg, through the knee, up the insides of the hip, even up through the chest to feed your heart. That's your kidney. The bladder, I hope I'm not boring everybody out there, but just follow along, I promise. The bladder meridian basically goes down your spine, down your back on both sides, through your glutes, through your hamstrings, through your calves, all the way to your heels. So when you take a Cipro and it disrupts the biome within your bladder or kidney, the chi gets messed up, if that's the word. I hate to use that term. But you will start to see people with plantar fasciitis, heel pain. You get it, don't you? You get calf cramps, and you go, well, you know what? I've always got to stretch my calves. I don't know why, but I always have to stretch my calves. Another one, the arch of my foot can get cramped pretty bad. That is huge kidney. The bigger signs and signals, and I'm getting all excited about this, Aaron, but really, when you say I have kidney issues, is you'll bonk at literally 2 to 3 o'clock. Guarantee you get super tired at that time of day. And whenever you have any type of hormonal changes, you feel like you retain a little bit of water, a little bit of fluid, and you get a little bit more emotional than usual.
Well, yes.
That's right. And so, but all that would come to say is that when you tell me I have heel pain and calf pain, first thing I think is kidney, bladder. And that's all the questions that go through my head. When you tell me, literally when you say I have this, calf pain, I have problems with urination, I pee a lot at night, my brain's already going to that whole structural component with the organ.
Okay. Well, this brings me back to my original stammering question that I asked about this person that came to you. Because I'm thinking to myself, a person comes in, like, now I'm the person. Okay, I've got two issues. I've got recurrent kidney infections, and I have chronic plantar fasciitis and Achilles tendonitis. And as me, as the health consumer, I'm like, those are not related at all. Like, how would somebody, what point does somebody get to where they're like, Dr. Motley, please tell me how these are related? Because I honestly think the average health consumer wouldn't, I know for a fact the average health consumer who's not savvy to traditional Chinese medicine and these meridians would have no idea to even think. And my hunch is that most medical practitioners wouldn't think, oh, you know what? Those are related. You should go see a traditional Chinese medicine doctor. So like, how does somebody come to you? Are they completely at their wit's end and they're like, I'll do anything? Or how?
Normally, that's a great question, Erin. Normally, they are at their wit's end. Most of the time, they will tell me that, Doc, this is the final straw. I've literally tried to pick up as many straws as I can. So I've had that statement happen quite a bit of times. But usually when people do come in, you're like, you're right. They are kind of like not grasping for something or reaching. They literally are to the point where maybe it's like in the culture where people are literally saying to themselves, there has to be something more. Like it can't just be like my shoulder just keeps hurting, blah, blah, blah. It's something, and there has to be something underneath it. And I think the culture is getting smarter. Not, I hate to use the word smart, but getting more aware that I have to dig deeper because everything we're taking is just masking symptoms. So most individuals, they don't come to me usually with the thought going, hey, I wonder if the organ's causing this. But what they will say is literally after they've done their shoulder and they've done a therapy and they have gone to everybody, somebody usually in the grapevine will say, hey, you need to go check Motley out. He always finds these different things, this Chinese medicine stuff. But thankfully, like maybe I've helped their friend or helped them do well. Yeah. That's the people that usually come though. Yeah.
That makes sense. It would have to be somebody who's experienced it because I wonder just the average health consumer coming into it on their own. Although I agree with you, I completely agree with your sentiment that the health consumer is becoming more autonomous, they're advocating for themselves more, they're thinking a little more critically and maybe even laterally, just they're thinking bigger. They're actually trying to seek out things. It's interesting that you brought up as your origin a pain in the neck because that's part of my origin too, is I had this debilitating neck pain and it was like, I will pay anybody anything if they can get rid of this pain. I don't care what it is. I don't care if it's magical fairy dust that gets rid of it. I don't care. It ended up being for me a craniosacral treatment that handled it. But I would never have thought to go there. So I think this is so interesting, and the type of work you do, it's just something I'm so unfamiliar with, and I wonder how do you share your wisdom with the people so that they can start to pick up what you're doing?
Well, I think it's been a lot of years. I think that anybody that's listening right now, they would talk about how could Chinese medicine or the electricity, or we call it chi or prana or life force. How can I convey that to people where they don't get glazed over, and they just go, I have no idea what you're talking about. It's been a big journey, but I will say that most individuals, when they first come and introduce themselves to Chinese medicine, all they've really heard about is really acupuncture. But when I make connectivities, it's not because I discovered them, but the connectivity that the electricity or the chi in your body creates, this is where it gets really cool, is that I tell people that you're not just connecting certain dots. What you are is melding. You're melding your mind, you're melding your physicality, your biochemistry, you're melding your organs. And so what we're trying to say is it's one unit. Now, that sounds kind of cliche, but when I'm conveying to individuals, when you show to them, for instance, when I said you had a calf issue, now the other aspects would be, and hopefully everybody would follow along if I get too wordy, but let's say this, the nerve that helps feed your heart and the pericardium, it's a nerve, it also swings back by here and goes up to your upper back near the meeting of your neck. And it feeds these little shoulder blade muscles called subscaps. What that means when I talk to them, if a person has a heart issue, and you can tell it by the redness of their nose, you can tell it by the lines on their ears, by the lines on their hand, the color of their hand, you could say you would have a heart issue. Then you would say, well, do your shoulders hurt? Yes, doc, they always hurt, all the time. In fact, they say I have torn rotator cuffs. Okay, so there's the connectivity of your structure to your organ. And then you say, well, your heart's a little tired. Do you feel like you've lost vision or direction in life? No joy. And they'll say, yeah. All that to say is when I talk to a patient, and you don't even have to say anything at all, Aaron, you can just literally say, you can look at their face, look at their hand and say, do you have this and this emotion, this? And then they're like, how did you read that? You know, and I'm like, it's Chinese medicine 101. You learn the lines, you learn the meridians, you learn the emotions aspects of it. And that's why I'm thankful. People that come in, they literally, it's not just for like, I want my heart chi to get better. It's never like that. They literally will come in sometimes there and they're like, oh, hey, I'm about to go into a meeting and I have no drive. I don't even love this job. And they'll tell me all these things like, can you do something to bump up the chi to my heart or my body to help me with that emotion? Those are the types of requests I get now. Anyway, I digress. Yeah, but
No. See, now you've just opened a whole another can of worms because so the menopause narrative very big in the health and wellness space right now. And that's the phase of life that I'm in. Not to give you too much information, but that's where I am.
Okay.
So one of the weird symptoms of menopause is frozen shoulder pain all of a sudden, right? Another symptom, and I got this from the functional medicine doctor I'm seeing for my menopause therapy. One of the mood symptoms is anhedonia, and I was describing that to her. A loss of joy, a loss of motivation. She says, oh, that's a menopause symptom. Loss of estrogen causes shoulder issues and loss of joy. Now you're connecting them in terms of chi, and it's like, that's like, do you know what I mean? Because like that's women in menopause get frozen shoulder and they leave their jobs and marriages.
They literally, they can't have enough drive and focus because the heat in their heart's so low. And if you read Chinese medicine textbook, if you look at menopause, they will talk about one of the meridians called the triple warmer. Okay. And all that means is fancy verbiage, meaning there's 3 compartments in your body. And they help produce a lot of energy because of the fascia that's in the compartment. The fascia is an energy producer. But one of the compartments is up in the heart. And the other component is down near the ovaries and the uterus. The second one's in the digestion. So you have heart, then your ovaries and reproductive, and then your digestion. So when you go into menopause, they say one of the main areas that always gets stressed because you're moving blood flow, you're moving hormones, is the pericardium, your heart. And so I know if you're going through menopause, you would have to strengthen your heart. Like emotionally, physically, like taking even heart or, glandulars, but also cultivating good relationships that are around you that give you fire. I'm not trying to get too deep into it, but when you're going to menopause, the fire is fed by the wood. Wood feeds the fire. You would need individuals that are to feed you, that have wood element. I'm a wood element. I look like a tree. I'm tall, I'm lanky, I have ropey arms, but the wood element is actually a person who likes growth, okay? Oh. Trees grow. You would need people around you that help you grow in this time. So you don't need stagnant people. I'm saying that would give your heart fire. I think I'm going a little too far with this, Aaron. I'm sorry, but anyway, yeah.
No, you're not, because I have follow-up questions. And apologies to the listeners who are not interested in my follow-up questions, but this is interesting. So do you think humans have an innate intuition about this stuff? So the ideas of traditional Chinese medicine that for example, like seeking out people who help you grow, is there an intuition that we have around this? Do you think that if an unencumbered human could listen to their body, quote unquote, which is such a cliched phrase, but hear me out, could listen to their body and say, you know what I need some growth. I need some expanders around me, people to help me grow. Do you think there's an intuitive piece to traditional Chinese medicine that we've kind of overwritten?
I do believe so. I think you worded it beautifully. I really do. And I can go as far, in my opinion, is that if you need growth, that people talk about pheromones and they talk about different things that could attract that into your life. But seriously, the energy that the organ gives off, this is one angle, I'm saying, the energy that the organ gives off, my liver helps me with histamine breakdown, cholesterol, hormones, and growth, right? The energy from my liver, if that's my constitution, innately will produce more chi and more vibration and more output. This is an energetic aspect. You would then feel that. And that's why you would seek out an individual that could have a little bit more liver chi, a little more growth. That's how I think humans are very intuitive about it. I think we can feel vibrational patterns. And if we're not numbed, but I do believe that even they say this is how deep and go. Your rods and cones in your eyes, guys, they filter out red, green, and blue. Okay. But what that means is at certain times of the year, your DNA, your chromosomes emit different types of light according to the crystalline structure, which means you're more in tune even neurologically to have certain color vibrational patterns that are prominent in your body at certain times of the year. Whatever can feed that color or whatever can feed that frequency, you will attract. You will look into the world and you'll find that frequency. You'll see the wavelength, you'll find the color. You're going to be like, oh, that person looks really cool, or that color looks really well. You will innately link into it. And I hope that's a decent explanation. And that's even with sound therapies too. I think humans, though, you know as well as I do, I can tell you're very intuitive. Like you look through people, not through them. I can tell that you're very intent with people and probably feel them a little bit too much, especially you're a very heart-oriented person. I can tell that right off the bat. Very passionate, can almost be type A, but you have to hold that back. I can tell that just from facial diagnosis, right? But personally, though, it's like you would have to have like more of a feeding in the sense that if you are in this time in your life and you found some people that could like feed into the fire element, that's where I'm saying like knowing more about yourself. Like that's the part you just said, knowing about yourself, that's the biggest aspect of it. All that to say, I'm going to circle back around. When people know this inherent individuality and sensitivity, let's circle back. When you're that sensitive like you are, I really believe this with all my heart. The senses in your skin even are heightened. They even say that a lot of these Chinese medicine practitioners have heightened amount of sensation, like you feel it, right? They say that individuals have different hair response on their skin because you can feel more than other people. Now that's not me just saying that. I just find that so interesting that your body can be that sensitive. So when you feel it, right, and you're talking to somebody, you go, I already know what this person's thinking and I can feel it. And you're the kind of person who would try to give people benefit of the doubt to a point, right? And that's how your system picks up on vibrational patterns. I just think it's very interesting. And for everybody listening out there, I got on this tangent, but I really love how your body can use all the senses, and some of us have a little more heightened awareness. I'm not really like that, Aaron. The only reason I'm very decent at this, I say good, is because of consistency. I'm one of those kind of guys that does something over and over and over again until I get pretty good at it. But there are some people like yourself that could fill up pretty quick. So
interesting.
That's a long way around the road to say, yes, humans do have that innate intelligence.
Well, also interesting that, if you are quote unquote, diagnosing as somebody who doesn't maybe have, as much of the innate intuition, but you've learned it, that's very empowering message too, I think. I always think about the way to empower the health consumer, because we are health coaches here, all of us listening are health practitioners, and there's this sense of self-determination and autonomy. We want the client to recognize in themselves, like I'm doing this because I want to, and it's important to me, and I know how to do it, and I have the skills and resources to do it. But to imagine, a lot of people, health consumers, and you probably run into this in your practice, think, this is my lot in life, I'm stuck with this is my genetics, this is my destiny. And anything really can be learned, even like an innate wisdom can be learned. Yes. If you don't, if you haven't cultivated it.
Perfect. I think, do you believe like that innate intelligence, like you can get back in touch with it? I think that's what it takes. It's just like us really listening to our bodies. So I'll tell a lot of patients of mine, as corny as this sounds, I want you to go at night and to be very, very still and talk to the organs. And they're kind of like, what do you mean talk to the organs? And I think that awareness of coming back to the place of like being able to communicate with your organs and with your body really allows you finally to have that angle of being able to listen and to feel more and to allow the body to be like a huge lightning rod, if you will.
Wow, cool. Let me tell you about my friend Carolyn. She's an athlete with a passion for health. She'd been health coaching friends, families, strangers, not even knowing it was a thing. She just felt called to help other people live their healthiest lives. Then she discovered the Primal Health Coach certification program, and she went from feeling like an imposter to belonging to an amazing community of like-minded health pros. Confident and finally able to enjoy a fulfilling and profitable career doing exactly what she loves. Carolyn is one of thousands of certified primal health coaches living their best lives and helping their clients do the same. The Primal Health Coach Institute offers a variety of health and fitness certifications and specializations. Our graduates are practicing unique coaching specialties and changing lives in countries all over the world. We're always growing and evolving, so come grow with us. Visit primalhealthcoach.com to check out our courses and offerings. Well, I like where we've gone so far with this. I have a million more questions. I'm so
I know. This is a good combo. I'm really thankful.
It is, and it's so far it's because I'm incredibly curious and really not exposed often to traditional Chinese medicine, and it's just fascinating to me. Just the complexity, the dynamic, the multitudes we contain are so missing in the sort of traditional common wellness narrative. And I personally, for example, I work in the weight loss space, so I work with women on weight loss. I work with women my age on weight loss who are kind of given these obtuse eat less, move more rules. Doesn't factor in their lived experience, the psychosocial aspects, their programming, their emotions around it. And I try to fold that stuff in, but it falls flat. So here's kind of where I want to put this question next, because you're a practitioner with a successful practice. We're all out here trying to be practitioners with successful practices, and you have a very esoteric specific message. And I know we talked about how you get a lot of business from referral, but how do you message what you do? As a loaded question. How do you message what you do?
Yeah, that's a great question. I mean, I got to think about this. I think that in having a mixture of different types of modalities that you put into one, how can I resonate with individuals to actually jump on board, if that's the word I want to use, or this phrase, without sounding, I always say this too intense. I think the message over the years, if I really can look into it, is people say we're one unit. We're not separate pieces, right? We're one unit. But one of the biggest angles was I always could tell you if an emotion or a stress response was creating your physical element. And number two, I always dealt with hidden infections. Those are my things. So I had to come from that angle, Aaron. I can't say anything profound. I literally was the guy, if I feel this way, if you had hidden infections, if you had a hidden problem, they would call me. And to convey it, I get what you're saying. I had to convey to them that I could hopefully use modalities that would allow me to actually find the frequency of the infection when your blood work says it's not there.
Right.
And that's how I kind of related it to the public, yeah.
Amazing. Okay, great. Now, good. So you're the hidden infections guy. How does somebody know, what is a hidden infection? What do you mean by that? Because, how would I know if I have how would anybody know if they have a hidden infection? Do you know what I mean? How do they self-identify as somebody with a hidden infection?
But Aaron, you know me, I just love talking about these things because people think I'm going to be gross, but I'm not. But I always tell patients, okay, for hidden infections, I always ask them about their poop. And people go, oh yeah, okay, well, I have poop here and there, and they tell me their color, and they tell me the texture. That alone will tell me if you have certain types of infections. But when they have a hidden infection, they're in the form of styes around the eyes. Random rashes or pimples in certain areas consistently. And for many, if you had warts or any type of skin tags when you were a kid, but they diminished and went away, then you have cold sores randomly. And you also have certain types of coloration on the face. So I know that's a lot to take in, but when I look at those things in the body, I can tell if you have a hidden infection going on.
Whoa. Okay. Poop and skin. So the skin stuff's so interesting because it's almost like the skin is this cry for help. It's the external organ that we can all see, and it's almost like, hey, I've got this rash. Can you please help me? Please help me.
You have great skin, by the way. Just saying, great skin.
Actually, my new monitor blurs my skin texture, so this is not real. I don't know. It has a filter built in, but anyway, it's fine. Thank you. Interesting. So, okay. Somebody says, but the thing is, people think that, for example, I have rashes, I have warts, I get cold sores. That's just me. Do you know what I mean? So there's another level of somebody having to believe that there's something else going on, right?
Yeah, that is a very hard thing because, one of the things my heart goes to individuals is that when patients come in, you don't want to give somebody something else to think about. You don't want
Yeah.
them to think like there's something wrong. But I will say that I'm very cautious about that, Aaron. When patients come in, I'm like, don't think I'm telling you to freak out because there's nothing to freak out about. But for instance, if you have the plantar fasciitis, if you've had such and such skin tags or whatever in this area, I have to make a mental note because later on in life, that chronicity, that chronic area will show itself.
Yeah.
And that's not like being negative. It's just, I know it will. And
Yeah.
even when patients come in, they'll have like certain signs and signals. Like I've known guys that have come in and they have heart indicators, every heart indicator. But they've had to go through Lyme disease. I'm not going to go tell the guy, okay, you've had this. Now you got heart stuff. I'm not saying that. I say, okay, what we need to do is you need to go to a cardiologist and you need to keep an eye on this because it could get weaker. If it does, you need to come back. And that's tough when I'm the hidden infections guy because I think some people they kind of get nervous. Like, you can't have to be nervous about it. What it is, we're trying to cut it off at the pass and keep it from developing into something a lot deeper, a lot more chronic, yeah.
Interesting. So what would be an example of hidden infection?
Oh, strep.
Strep?
Oh, Aaron, do you know how many people are hidden strep carriers?
What?
I would venture to say, and I would love for any microbiologist, not to challenge anybody, to tell me the info, send it to me, that out of 10 patients, I would say 8 of them usually have strep hidden. And it's not like, oh, I have strep throat. It's literally, yeah, doc, every season my throat gets a little tight or I get a little sore throat randomly. If I go into this place, I smell the fumes and my throat gets tight. True. Or I get random swelling around my throat, or I've always had a rough throat, or I feel like I cough randomly like throughout the day, or I get small amounts of tonsil stones. That, or I can't be out in the heat. Every time I'm out in the heat, it's almost like I'm allergic to the sun. Or when I go into the water, I break out. Those literally, or old pneumonia, strep pneumonia, Klebsiella, those kind of infections, they'll hide. And what will happen is you go get a person with a thermography and they'll show thermograms where their neck and their clavicles are just jacked up and the areas underneath their armpits. And you ask them, did you have strep? Oh, yeah, I had strep. I had mono. I had strep like maybe 6 times when I was a kid. And this happens all the time. And I get adamant about it because if somebody comes to you and says, okay, Aaron, I've got really bad hearing issues. Okay, tinnitus. And I'm not the solve for that. What is tinnitus? Tinnitus is always related to the kidneys. Kidneys always control the ears in Chinese medicine. So when somebody gets tinnitus, my first thought is they have a kidney infection. And you will find out with people who have strep in their throat, that strep got all the way down to their urinary system and took house in their kidneys and in their head. So they have a double whammy. And you go get earwax and getting their sinus stuff checked through a lab, and they'll have strep. Crazy amounts.
Whoa.
I mean, Epstein-Barr, strep, some people have Lyme disease. But between you and I, people don't even realize how much protozoa parasite they have. Like Giardia. Okay. I mean, that is crazy how many people have Giardia. Or malaria. See, I'm getting all adamant because I get excited about talking about it, but that's the truth, though. Yeah.
Okay, well, actually, so the parasite thing is so interesting because I feel like I was completely dumb to the existence of parasites until in the last few years, and now I think I probably got 1 or 2 or 10 or a million. I mean, is that what you're thinking? Are we all just riddled with parasites, and are they all?
We all do have parasites, but I will say this: I think that I've seen individuals who've come in and who've had very low signals from frequency-based techniques and biofeedback and even, poop checks that they don't have as many parasites at all. Now, I will say that you can get rid of a lot of your parasites, but I do believe, I don't know, maybe you can talk on this with me, Aaron, is that I do believe people do have parasites in their body because the body is a way to allow certain things in their body to eat up other things. Could be a possibility.
Okay. Symbiotic kind of thing.
It could be. And, when we talk about parasitic activity, one of the hardest ones for people to understand is that a lot of your parasites come from your fruits and vegetables. That's just normal. A lot of them come through your tap water, your groundwater. You bathe in it, and they're so small they can get into your skin. Okay. But that's one of the biggest things when people talk to me about going into the lakes or the rivers. Those are huge. And what happens is these types of infections don't just stop like on the skin. When they get inside, they like to go to the liver, like to go to the spleen, like to go to the lungs, they like to go to the brain. And we always think of parasites as just big, long worms.
Yeah.
And we are not talking about that. I'm talking about those microscopic ones that can get up into your ears, into your nose. I am not exaggerating, guys. I've had patients literally in the last month, in May, bring me 3 pictures of them blowing out a small worm out of their nostril, like 3 inches.
Yeah.
3 of them. Now, I'm not saying, like, I'm telling you, and you think, oh, it's just snot. It's like, no, it's not snot. It's literally a worm. And is that all the time? No. What we're talking about, little microscopic protozoa, look like little itty-bitty, oval things like you see under a microscope.
Mm-hmm.
But those tear up your red blood cells. They can get into your brain. And this sounds scary, but it's not. I'm just saying, you can take the big 3. You could take Artemisia, wormwood, black walnut. You could even do like Vedanga. That's one of my favorites. But I'm just saying, one of my friends, I can plug her away. She's great. But Kim Rogers, rogershood.com. She was in town the other day, and we were just talking about different types of parasites. And there's certain herbs, if you just put them to combination, they'll go in and kill all those parasites or pull them out. Yeah. So it's a bigger problem than most people would think. Yes. So,
man,
you could have millions in your body, Aaron, but you wouldn't tell. You got, because your skin tone's good. Even say with the camera, I'm looking over here. That's why I look over to the side here. But usually when a person has tons of parasites, the body won't release them all at once. In fact, some people will do 6 weeks of a parasite cleanse, and then they'll just release a ton of fluke worms out of their body. Now, why does the body get selective? That's the question. I really am with you. I'm like, why does it happen that way? How can the body hold on to something like millions of such? Think about it. If one tapeworm could release that 10,000 eggs in certain lunar phases, I mean, if it's been in your body for a long time, you could have quite a bit of eggs. But we could be afraid, but that's not to be afraid. It's like, no, there's big herbs that you can take to clean that stuff out. So the parasite thing is happening.
Yeah, I'm not afraid. I'm deeply curious to know what little beasties are living inside me. Like, that would be worth it for me to try just to see. But like, is this a new problem? Is this like a modernity thing, or have humans had parasites in them since forever?
Oh, and if we can read reports, they've been around for so long. I had patients, they're in their 70s, but if we're going to go even back in the 50s, 50s or 60s, my grandmother was raised on a farm, and so my mom was raised on farms in Korea, but both sets of cultures actually did deworming. And so they knew they would get certain worms through the
right.
animals. So they've been around. I had a patient, she said that her doctor would come, every quarter, and some of them would even take kerosene or turpentine. And I know people still take turpentine.
I've heard of turpentine.
And she would do it. She goes, you know what? And when she came to me, she kept having heart palpitations. Now through biofeedback, I found a small worm frequency that was related to heartworms. Get this. And I said, I'm not telling you have that. I'm saying there could be some memory or something in that tissue that reminds it of worms. She goes, oh, no, I had heartworms. She goes, in fact, my country doctor would come giving them some turpentine, do the other things. And she said, for the next 3 days, I just poop worms. And they would look at him. He goes, oh, yeah, those are heartworms. Because the question is, could you still have heartworms or them reproducing in the heart tissue? Or does the organ have the memory of it? Back in the olden days, quotation mark, is like, they're doing things to help get rid of parasites as much as possible. So we still should do it, though, honestly.
Yeah, like in the olden days, we would have put those herbs together and done, or something like that, right? Mm-hmm. I did hear that recently, that in some Asian cultures, they warm themselves every seasonally kind of thing. Is that right?
Yeah, my mom's culture, they do in Korea, and I think even in Japan. And there's I say advancements, but even in certain areas of India and throughout Asia, they use certain types of medications and certain types of herb processes. Just depends on what kind of person, but they usually are always doing some kind of deworming. And I think to them it's not weird. Like they don't think it's weird at all, to deworm.
They probably would think it's weird not to do it.
Yeah.
Like, wait, you're not deworming yourself? Truly.
And even if you look culturally, like when I go to Korea, they would wear masks, not because of COVID. If they ever thought that they were getting sick, they would wear a mask as a respect. Like, I don't want anybody else. So, like, they have cultures of, like, no, none of the family, we all have to do a worm cleanse because we don't want one person to have worms because it can infect everybody else. But, pharmaceutical, I'm not going to get into that. Like, their avenues, they know that helping get rid of parasitic infections could change the medical structure quite a bit if it was just us having a few herbs and a tincture and saying, hey, this will get rid of your SIBO, this will get rid of your IBS. That would be hard for the culture to take, I would think.
Wow. Well, that was an interesting little, shall we say, wormhole. So I want to get into kind of what you do, because we do like talking about people like practitioners and their practices and how you built what you built. So you have a brick and mortar or virtual practice?
Brick and mortar. I'm right here in that room. This is where I treat. Yeah.
Amazing. And then what else do you have? A podcast. Talk to me about the podcast. And what else are you doing? Like, fill me in on what you do.
Thank you for asking. I do Ancient Health Podcast. Ancient Health Podcast was started by my friend Dr. Josh Axe, and many people know Dr. Axe. He did Ancient Nutrition and Dr. Josh Axe show. He started that about 3 years ago, and me and Josh are close buddies, and he had gotten an injury. So when he started the podcast, we were starting it up, and he had a very bad infection in his spine. And I started the podcast, but we had, Josh had asked me, he's like, can you just help with this part of the podcast? So that's how I started the podcast. Thankfully, over the years, seeing him getting better, this is great. Do the podcast, and I do full-time practice, Aaron. One of the problems I do have, guys, is that if I'm here at the office, normal days are 7:30, 8 o'clock, and I go till 6:30, which is, I was doing quite a bit. And I want to tell you another part of the story, but with this, though, being here at the office, I'll just transition over to do the podcast. And then when we're doing social media, I would get here early in the morning to do some videos and stuff. So little bit of podcasting, full-time practice, and Instagram and such like that. But I got a membership. I'm revamping the membership even now. I meet every week. I go live on a Q&A. You listen to the podcast, Aaron, you just jump on live with me. And then you ask me questions, and we have a good family. I really do think they're family, and they're really great. And we meet every week, almost every single week. What else, Aaron? I mean, now I'm getting more into maybe do more writing, maybe possibly in the future for it, because I've had and my friends have said you need to start doing this, and I'm like, okay, so doing that. But I'll say the in-person practice, though, I do virtual clinic. People can sign up, and I can do okay with that. I'm just saying over the years I've had to start to literally slow down recently, not because of I don't want to keep doing in-person. It's just you have to be careful of your fatigue as a Chinese medicine practitioner, any practitioner. And I want to practice what I preach, but I will say the experiences I have here, Aaron, every day is what I talk about online, because that's the only thing I know, and I'm thankful for it. So when I go on the podcast, I say, what do you talk about? I was like, I just talked about the experience I just had yesterday. Yeah. So it was relevant, though, because it's happening here. But a lot of different things I've had, goodness gracious, been all over the board.
Yeah, absolutely. And I think that's the common experience that modern health and wellness practitioners of all kinds are having, which is, wow, I'm very multifaceted all of a sudden. I'm a practitioner and a podcaster, and I'm a social media talking head, and I want to just validate that it feels overwhelming. It can feel overwhelming, especially when you get to a certain level of success and impact, right? So being able to impact a lot of people is what we all want. And when you get there, it can feel like a lot, like you've lost protection of your own sort of mental energy and your personal sort of space and time.
Yeah,
I think the membership's an interesting idea. So these folks pay a membership and they get access to you once a week in a live Q&A style call?
Q&A style. I think it's what kind of sets it different, possibly, because I'm trying to think about the price point, because I didn't want to have a membership that was so extravagant as it's not. It's I just want it to where I always say it's the person who is fed up without they just want to know how the small signs and signals can be fixed up. So I just do I think it's $35 or something bucks a month, and then individuals have the option. Every Wednesday night, usually around 6:30, I go for about an hour and a half, 2 hours, and people do come in with a lot of good questions, and sometimes it is almost like I'm not treating you medically, but I just give my opinion. But we get a lot of questions, like a lot of good questions, and they're pretty deep at times. But I look at the people who worked on me, my docs, and I wish that I had the opportunity to jump online with them every week and just like shoot the breeze or talk with them. And so I was like, well, I want to have that format too, just for individuals. Because I have a ton of coaches, healthcare practitioners, acupuncturists that come on, and I'm not talking at them. I'm not telling them more, but we have a really good combo. So, yeah.
Amazing. Wow. So you never really know what's going to come up on these calls. You have to be able to just roll with it.
You do. All the time. It's like I always take every conversation, like Ben Greenfield, he was talking about his memberships and such. And I like listening into their conversation or any conversation within a membership because I get these little hints. Like I try to stand more when I do my podcast now because my left ankle can get real tight. But those are like ideas I get from like other memberships. I'm like, okay, it's little things here and there.
But what I like about this, it goes back to something you kind of touched on, or I interpreted from what you said earlier, which is this idea of you have a very clear expertise and you've just went all in, you've gone all in on that. And it's like, I interpreted this from something you said earlier. Like I kind of talk about the same stuff all the time. I'm the guy who talks about this. And I actually think that's an overlooked aptitude that a lot of health practitioners, I think we downplay the importance of that. You want to put your flag in the ground as the expert in this one thing and not this generalist that kind of does it all, because then you can create a community like a membership where we can't wait to come in here. Dr. Motley has to say about this thing that we already know he knows what, and knows about, right?
Yeah.
That's the benefit of being an expert.
Oh, I appreciate it. I do think that in any format, having to like look at a whole bunch of systems and trying to become a jack of all trades, even I myself, thankfully, I paid attention to my own advice. I got to a point, Aaron, where I was, of course, you checking hormones, doing all the labs, doing different things. And I just really looked at all my patients and I was like, what they really love for me to do is find their hidden infections. That's what they love me to do. And they really like that I can possibly tell them about the programming emotionally that could keep the organ sick.
Yep.
So those are the two things I really concentrated. I just started referring out to other practitioners. Even though I could help in certain ways, I'm with you 100%. I was like, no, I'm only going to be able to service people better if I can dive deep, like you said, 100% into these things, because I'm so thankful. I got a medical doctor that's in the next building, and I would find strep and staph in my own way on some of her patients and not overbearing or telling them to disagree. Not at all. I would say, can you go tell the doc what's going on? And she would find out, and she goes, yeah, that's there. How did he do that? And now we share people back and forth.
Oh,
and I think that's pretty cool, though.
It is.
Yeah, it's really good.
It is. And I will say, I've picked up on this in our conversation. You're not steamrolling your perspective. Like there's a real collaborative energy to the way you might say, lower leg and calf issues can be related to the kidney. And then you might get the person to explore, like I'm imagining on these membership calls, if somebody comes in with a feeling or a symptom, that you would coach them in a sense to say, well, it could be related to this. Does that ring any bells for you? Is there anything there that we could explore? And there's an empowerment to that, right? It's not just the teaching and telling, it's the sort of nurturing from within to a certain extent. And so the collaborative relationship with the doctor next door is a good example of that.
Truly. I think that when you have a combination of people asking you real questions, when it does give power into the back into their own hands, when they are able to then start to deduce on their own. And I know everybody has the ability to do it. One of the things I love about the membership is when I started telling people about like a Chinese medicine clock and time of the day that causes this problem to this problem, and the members would literally send a message in and be like, hey, doc, I know my liver is screwed up because at this time of night this happened. And you just, cool. Okay, so like you say, the collaborative effect that you're having with these individuals, and they're able to take like a problem and then deduce all the way down because of just some simple steps. And I think, like you say, the doctor next door we miss that bedside manner in regular hospital settings. So it will be that we would have to take some things upon ourselves to learn in this manner. And really, when I go into the membership, I try to bring other people on the membership that do different types of modalities, because I know I don't have every answer for everything. I just want to be the guy that sort of tells you what
Yeah.
I think hidden infections could be doing to you. And that's where I come
Amazing.
from.
Well, I think it's deeply empowering. I think that on a lot of levels, the healthcare industry, the wellness industry, which I think the last statistic I saw was the wellness industry is like $14 trillion industry now. It's crazy. We made it into the trillions. We did it. But it has, whether this was intentional or inadvertent, it has disempowered the health consumer. So that relationship sometimes with the doctor is very disempowered. Tell me what's wrong with me, doctor. And the doctor will say, well, it looks like this. And, in some cases we need that. But in other cases, it's like, what can I know about myself here? What is there to learn about myself and intuit, which is just more empowering in a manner of speaking.
It is. I think that we're coming to the points in healthcare where, like you just said, we don't want any disenchantment on the consumer because there's just so much information. And I agree. Even I can get analysis paralysis when I'm putting out information because sometimes I'll go, if I put this out there, it may cause more questioning in some ways to a person if they're on the right track.
Yeah.
So when you take information, we're trying to create some soft communication. And
Yes.
I agree. I do love finding every single small molecule, but I'm with you that you got to keep some things simple. And here are some simple things you could do for your health. And I think that even with memberships or when I have patients load, we don't want them to become disenchanted because they love connectivity. They love community, like you said, not only with themselves, but with other people that are like-minded. That's why I like the membership. But I have found even in my practice over the years, when I'm not acting guys like I had this huge practice. I have a pretty big practice. I've treated a lot of people. Thankfully, it's probably over 100,000. In my career, seriously.
Oh my gosh.
And the one thing, though, is I never wanted to get so big that I forgot talking to people. And so I made a lot of friends and through the years, through the patient load. But I knew personally, and I want everybody out there to take the same advice, when I got to a point, I knew that I couldn't keep the connectivity because it was just too much work in my body. And that's what's happening into the consumer. The consumer's out there, and sometimes I think there's just too much information about one thing, and I think it's just overriding people's sensorium, basically.
I think you're right. And I actually think that ends up being where the health coach, the health practitioner ends up being the soft place to land. For example, a lot of health coaches are very concerned about AI replacing them. And I think there's no concern there because this sort of, this like a U curve of wanting all the information. It's about to come down and people are going to actually want less information and say, maybe I could just hook into one person. I get this even in my practice. There's a million people selling weight loss out there, but people come into my practice because it's like, I just want to be with Erin for the next 6 months and just focus here and maybe put my blinkers on. So this just makes the case for needing the human to human connection, which humans have always and will always need.
Oh, I love it. And I do. I think that one of the hardest parts, do you find this, Aaron, with your patients, your clients, and over the years, is you really do become connected, and you have some friendships, and they used to tell us don't get too familiar with your patients, but I'm like, it's going to happen. And you're right, people do just want connectivity. I think people same with you, they'll go, hey, I just need you to tell me that this is going to be okay. And sometimes I've had to say, no, you got to go get this checked out. But I think with AI, I've seen AI take genetic reports, and you've seen them too. They take that and they'll go through it, and I'll look at the report, and they'll talk about its intertwining with herbs and supplementation, and sure enough, some of the things it says are correct. But some people will live and die by that. But I know you and I, there's going to be a point where people say, yeah, this is great, but I really need to just talk to somebody about this and get some inflection. And that's the hard part about AI. And I'm not trying to get overburdened with this. The part that would be missing is because the general feel that you would have for your patient, right, Aaron? You would know that they could take this, but if I did, it would override their system in the sense it would make them emotionally feel fatigued and make them feel wrong. They would lose hope. I don't know if AI could do that. They don't know how this could affect a person in 3 weeks. And
That's right.
Well, maybe they make an app. I'm not kidding. I don't know. They're doing such crazy stuff. I'm like, but I can go down that rabbit hole, but we're not going to go down that rabbit hole.
No, I know. Well, okay. So, I mean, just really, really enlightening. And I appreciate everything you're doing. I'm just curious, like, if someone is struggling with unexplained symptoms, what's the first thing you'd want them to do or understand about their body?
I'm going to keep it real general. If you have an unexplained symptom, I always go down the route of hidden infections. Okay. So please don't get overwhelmed. When I say hidden infections, if you can't find an answer, I always go to common infections I would say most people will find. Okay. So what I'm saying is I always say get checked for strep, Epstein-Barr, or any type of herpes virus.
Okay.
So strep or staph, Epstein-Barr virus, parasites, possibly Lyme disease. Now, okay, I'm not saying it's the answer. What I am saying is that when you have unexplained symptoms, you could find if you have a heightened amount of one of those top 4 major areas. But it all will come down, though, to the simple questions of do you poop well and do you pee well? I'm sorry, that sounds really, really basic. But people in our country and around the world are literally functionally constipated.
Yeah.
Not only physically, and you know this as well as I do, Aaron, but emotionally. And if I check somebody that comes in with acupuncture or Chinese medicine, most all of them will come in, and the first thing I'd have to clear is their colon or their kidneys, bladder.
Right.
So my first job is to tell them we're going to do something to get the big colon area cleaned out. So what does that mean? With those hidden signs and symptoms, no matter which ones you have, you got to be able to pee all your waste out and poop it all out and even breathe it out like lungs. And so I'm saying if you clean out the colon really well, I'm already saying this person is going to improve by 50% or 60%. Then I go into the other parts. And you see how adamant I get about it. I'm telling you, I've worked 3 visits in a row on most of my patients just to get their large intestine to fire up.
Yeah.
He's like dead as a doorknob. It's crazy.
Mm-hmm.
It
makes sense.
I'm getting high voiced. Sorry, Aaron.
No, it makes a lot of sense. That absolutely seems like the most reasonable place to start. Well, the first thing we have to do is clear out your excretory system so that you can excrete the things that aren't supposed to be there. I think that makes perfect sense.
But again, I can start to like harp on it. But when you start seeing patients that come in that have extreme amounts of eczema, and skin rashes. You've seen those. I've had some that their lips were so scabbed over in their neck from all the infection. And I'm not having all the answers, but when you say, well, I don't know what the issue is, the first thing that would come up to my mind is I'm going to check and ask this person that has strep infections. And because she had literally scabs over her thyroid area. Oh. And she says, oh, yeah, I got strep like 6 times when I was a kid. And they had to take my tonsils out. It did not go away. It stayed there. So I just want to get everybody to have hope. It's like when you found it, it's amazing. We found this on this patient. I was doing stuff for her gut, giving her some herbs. She found a doc that worked with us that did a specific type of antibiotic that helped with some of the strep. The next time I see her, most all her redness is like probably down 70%. And she's had this for over 4 years. So not trying to toot my own horn or anything. It's not that. Just look into those hidden infections and then make sure you're pooping well. It's one of my philosophies.
We all have to have a philosophy. I love it. It's direct. It's to the point. There's no ambiguity.
No, I don't want that. I want us to have clear steps ahead. So this has been really fun, though. I really appreciate your interview. This is great.
It has been fun. I appreciate you just kind of joining me down this sort of garden path of curiosity. Where can our listeners keep up with you?
You can go to Dr. Motley, at Dr. Motley, spelled out, DoctorMotley, Dr. Motley on Instagram, Facebook, TikTok, X, all the outlets, even on, I think, Rumble. And I have a YouTube channel. We just sort of put things up. And website is drmotley.com. Amazing. And yeah, just all the platforms. I appreciate you guys keeping up with me. I've been trying to stand and take pressure off my left hip the last few and my left ankle. And it's been like I had to move on it sometimes because it gets a little stiff. And then I tell myself, I'm like, I got to work on my gallbladder. That's what I got to do. Oh my gosh.
Well, I'm going to get me one of those Chinese medicine dolls and start figuring out where all my aches and pains are coming.
That's the biggest key. Is like you guys, everybody out there, get you a Chinese medicine doll. You find out where you're hurting. You go to the area where it's hurting, you look at the point, you find what the initials stand for, and you go to it and you look at the initials and say, okay, that's the small intestine. And then you go and look at what the function of it does on Instagram or Google. It'll tell you, yes, I have a problem processing food, I get bloated. And then you find out the emotions on the Chinese medicine chart and the time of day that the organ is most active. See? Right there.
You just taught us everything about traditional Chinese medicine.
And you go, it's just my elbow hurts. I'm like, no, it's not. Your small intestine is really, really tired.
Oh my gosh. I'm fascinated. I really do appreciate you taking the time with us today to give us a little glimpse into how you work with folks. It's really interesting, and I really appreciate your time.
Thank you. This is a fun, I can tell, and I get moving talking fast, Aaron, and I get a little higher pitched. And when I start rambling a little bit more, I'm like, I'm really enjoying it. I could talk to you for another hour, so this is fun. Thank you.
Awesome. All right. Thanks, Dr. Motley. This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.